free to reach out.
So we are going to transition right over to our next panel, and I think we have heard quite a bit on the benefits of virtual learning and the potential of distance learning that this pandemic has taught us. But of course, there are downsides. And I think, one of the more, I would say, insidious aspects of the coronavirus pandemic is, of course, how much the disease has reshaped everyone's lives, both directly and indirectly. And I think in terms of young people, on the one hand, among young people, especially children, they fortunately seem to have largely been spared from becoming seriously ill from COVID-19. On the other hand, though, the disease has taken an indirect but very significant mental and emotional toll on millions of children and young people who have been unable to go to school for months on end, or are now in the midst of this kind of yo-yo of reopening and shutting schools back down that many of us are finding ourselves in. So I wanted to just bring up briefly a study that the U.S. Centers for Disease Control and Prevention found that 1 in 4 young adults have considered suicide over the past 30 days. And 75% of teenagers are struggling with at least one mental health or drug-related problem. So, we are really in the midst of still learning about the long-term effects of virtual learning and the inevitable social isolation that comes with it. And, what some experts really fear might be a lost generation. So I think it's really important that we address this aspect of virtual learning. And on that note, I'm very happy to have Dr. Peter Mills of Cigna here today to talk about the issue. We've talked before about the importance of mental health and well-being during the pandemic. Before, you can go to actually our website, washdiplomat.com, to see our previous discussion. Dr. Mills is trained in medicine was trained at the Royal Free Hospital School of Medicine in London. He is an accredited specialist in respiratory diseases and still practices medicine on a part-time basis in London. In addition, he has a master's in infectious diseases and a PhD in cell biology. He has also been at the forefront of the digital health revolution over the past 2 decades, having helped a number of British and American organizations develop innovative solutions to health problems. And he's been medical director for Cigna Europe since 2015, most recently working closely with clients and providers to drive high quality care. So you are very much a man in demand, Peter. And it's wonderful to have you back and hear your thoughts on how young people can stay healthy mentally and emotionally through this pandemic. So, Peter, I want to turn the floor over to you.
Thank you very much, Anna, and thank you to the Washington Diplomat as well for giving me the opportunity just to speak with you briefly today about an area that I think is really important. And as Anna said, focusing a little bit more on psychological, emotional health and well-being, and how we as an organization at Cigna have put together some solutions that may be of benefit to you, to faculty and to students who are traveling around the world. I think it's true to say that pretty much every corner of the world has been affected by COVID over the past year. We are now sadly up to 1.5 million people who have lost their lives because of this disease. And we've heard a lot over this period of time about how many different people, members of society have been affected, particularly the workforce. Lots of discussion about the difficulties of working from home, juggling home and caring responsibilities. Many people have lost their jobs, sadly, as well. But I don't think we've heard very much, and certainly there hasn't been as much media coverage about the impact on students and how this has affected student life and the quest, if you like, for learning and knowledge. Over the past 6 years, Cigna have been conducting an annual research study looking at representative samples of people around the world and really getting a good idea about the things that drive and contribute to our own mental health and well-being. And for most of you, this graphic here will be no surprise. We know that physical health has an impact upon how we feel psychologically. We know our work life and what we do with our day has a big impact on that. Our relationships with family and friends and our societal bonds, and also our financial stability and the environment that we find ourselves in are contributors. But even in the best of times, it's quite difficult sometimes to juggle all of the competing priorities in our life. But the majority of us manage to a greater or lesser extent. But you then layer on the impact that this pandemic has had upon almost every single element of our life. And it's no surprise that so many people are struggling during this time from their own psychological health and well-being. And over the past 12 months, we've been doing a more frequent survey of people around the world. And it's very clear that we are storing up some significant issues for us as populations, as societies around the world. Just very briefly, almost 50% of people have said that the pandemic has had a negative impact upon their financial situation. And previously, I think we saw some of the numbers and some of the impact that this can actually have, both from the individual perspective, but also for universities and colleges around the world. One of the key things that we perhaps don't talk so much about is loneliness. And if you are a student who is in a different country, this can be really profound, especially with the lockdown and restrictions of social movements. And not surprisingly, this is really driving quite a lot of stress, emotional, psychological distress. So we need to put in place some solutions to try and mitigate against these issues that we're seeing, both now, but also even when we come out of the pandemic, because these things will have long-lasting effects on students, on the workforce, on people in society as a whole. So this is really the reason why Cigna has put together a new product, and it's really been developed with international students in mind. And we're calling this Study Well. And the focus is, as I said, on international students, either those who are inbound into the United States or those students who are outbound, who are going elsewhere to get experience and to study in a different environment and a different culture. Key to this is digitization of many of the elements that maybe traditionally haven't been particularly technologically enabled, certainly from a perspective of health insurance. So just like any health insurance product, it's going to cover medical emergency care. We've also added in prescription coverage as well. So if individuals are already taking a prescription medication, they can get that refilled in their new destination. Telehealth is one of the cornerstones that we have embedded in this solution. It's very difficult sometimes when you're going to a new place, a new location, to navigate the health system. Certainly the American healthcare system is really quite complicated. But also around the world, different countries have different approaches. So one of the key things that we've installed within this product is telehealth, so that individuals can get a consultation from someone who speaks their own language and who understands their culture as well. And that's always very, very important, especially in those difficult situations where you're not feeling well, you need some help. And so that's really forming one of the cornerstones of the solution that we're offering to international students and faculty. A key thing is also the emotional health support. We've recognized that psychological health, even in the best of times, can be impacted. There's huge changes that often young people are undertaking, and it's not a surprise that it impacts them from a psychological health point of view. So again, what we've embedded in here is the ability to have psychological health interventions and advice and medical advice, but also wherever you are locally, you can actually get some psychological health face-to-face interventions as well. Again, with all the other things, we have the other emergency things like dental care, etc., but also a community called Internations, where we have joined up with Internations so that international students can meet other people like themselves, perhaps from their own country, perhaps with similar interests, where they find themselves during their studies. And again, because we know that social side of things, the friendship, the bonding, is really, really important for our own psychological well-being. And we're wrapping this all up in our easy-to-use Cigna Envoy solution. We have a generation of people who are very familiar with using technology. Most of them, anyway, Anna, that can use the technology well. And again, it makes no sense to have to call up people or send in pieces of paper. And so we've really made a big effort to try and provide a solution there where people can easily access things through digital technology. Just want to finish off with a comment. As I said, sadly, 1.5 million, just over 1.5 million have already died. I fear that more will before the end of the pandemic. And it's certainly true that COVID-19 does rank as one of the 10 worst pandemics that we know about in history. However, having said that, pandemics have afflicted humankind for hundreds and thousands of years. They have been a common feature of our history, and probably will be again in the future as well. But I think the positive aspect of this is that we do get over this. This will be over, hopefully very, very soon. We've seen great steps in vaccine development and delivery. And in fact, today was the first day that someone in the UK got a COVID-19 vaccine. So this will pass. We will get back to a new normal. And I think one of the great challenges and one of the really positive things that we can take from this is that it's helped us look at how we do things, and particularly in healthcare. How do we do things? How do we support individuals to make their care appropriate, to make it predictable, and to make it simple, and also to make it affordable as well? So thank you very much for the opportunity just to briefly talk around this area. More than happy to take any of your questions. And also, if you would like to talk to us more in the expo area, someone from Cigna will be there to field any of your questions.
Mm-hmm. Well, thank you so much, Peter. And again, I think this is a theme that we've been hearing all day, which is to try and look forward. I quoted a story I wrote, Anthony Fauci, of the end will be in sight. The end is in sight. We need to remember that while still being cognizant of the fact that, we have difficult months ahead. And it's a difficult balancing act for people mentally. But I think everything that we're hearing is not just that the end is in sight, but that there are silver linings to this horrible pandemic, just as much as I was listening to one expert say that many people have PTSD following this. People who obviously have lost loved ones, depression, loneliness. I mean, is that something that you also are thinking of, that even once a vaccine is out, we will hopefully, knock on wood, spring and summer, this pandemic has finally ebbed, and as you said, we could return to a new normal. Are you foreseeing kind of a long-term emotional problems that will linger even once we have successfully administered a vaccine?
I think that's right, Anna. We know from previous major global events, be they infectious disease events or other tragedies that have occurred, the knock-on and the long-term effects upon people's psychological health are really quite profound. So I think even though there's great optimism for the future, we shouldn't ignore the fact that there are going to be people who are struggling and will continue to struggle from their psychological health point of view. So we need to put in place support for them, and different people, it means different things. One of the things that we're doing at Cigna, as I said, is creating a solution that has a number of these different psychological and emotional health support elements there. But also faculties, universities, colleges should be thinking about how can they support their students psychologically, especially those ones who are traveling across borders to new locations, new cultures, because it really is something that we need to take seriously.
Right. Well, thank you again, Peter. We really appreciate all of your insights. And as you mentioned, if you want more information from Cigna about some of its resources, all you have to do on the left-hand side is at the bottom, click Expo, and you'll be taken to the booths, and you can connect directly with somebody over there. So Peter, thank you again, and take care. Look forward to maybe one of these days doing an in-person event. We shall see.
Yeah. Bye.
Bye.